You eat with your whole body. It's not just your mouth and your eyes and your stomach. Your whole body is involved in eating. I guess the elephant in the room here would be most traditional insurance-based feeding therapy doesn't include what is needed for lasting progress. It's not a full body approach. It's not root cause approach. There's not that integration of the gut, the oral motor, the sensory, and the mindset together. There's not parent coaching. Sometimes you're not even present or allowed to be present in the room. It's more like they're checking boxes. They touch the food, check. Let's move on to the next skill. It's not true intentional progress. Sometimes you can see a little bit of progress. It might take a very long time to progress through those check boxes. Just to give you like a little quick aside, we had a parent recently who called and they had been in feeding therapy for years, she said. And she said that they spent 11 weeks licking a Cheerio, trying to get to that next checkbox. And I was like, that is not what feeding therapy should look like. That is behavior-based, and it's probably not at all what this kid needs to move forward. But why does this happen? Why is it not looking at everything? I mean, unfortunately, it's insurance. Insurance dictates what gets covered. They don't pay for sessions that are long. I will tell you that it's one code that gets billed. That's the technicality of it. And they don't care how long you see that child. If it's 5 minutes, 30 minutes, 60 minutes, the reimbursement for the clinics is not a very high rate at all. It's barely enough to cover the therapist. And it's really not even what the therapist should be getting. But it's just not enough time to dive deep. I don't know if insurance is 100% to blame. You know, I mean, there are absolutely some amazing therapists, I'm sure, that take insurance that are really knowledgeable. And, you know, they take insurance, but there's still going to be a constraint on how much they could do because they are limited by insurance. You can't see them like sometimes more than a certain number of times a week, or you might like allotted like 30 sessions or 25 sessions. And if they're contracted with insurance, you can't say, oh, if you want to extend your therapy, I'll just charge you extra and we can stay a full hour.